Okay. I hope I'm audible. First of all, I've just closed all these this microphone and all सबके लिए. तो I just want कि आपके लिए chat box open रहेगा. I just want everyone to just send me a hi in the chat box. I'll get to know कि मैं सब मेरे को सुन पा रहे हैं. Okay. 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 That's great. That's great. So I guess I'm audible to everyone. Okay, that's great. That's great. Now let me just present my screen. Just give me a second. Okay, that's great. My voice is cracking. Okay. मुझे लगा था कि ये इशू होगा. Just give me a second. Just give me a second then. Okay, I hope now it's better. So if still the problem persists, just let me know. ठीक है, आपके पास chat box है, chat box में आप मेरे को बता देना. ठीक है. Okay. So let me just present my screen and okay. So I guess we all know this, that we are going to have this webinar on Cauda equina syndrome. We'll be talking about the Cauda equina syndrome, and I guess सबने कभी ना कभी इस कंडीशन के बारे में सुना ही होगा. Just let me turn on my camera as well. Okay, I guess सबने Cauda equina syndrome के बारे में सुना होगा. So let's discuss about the Cauda equina syndrome, and then we'll be talking about a couple of other things as well related to the Cauda equina syndrome. First of all, we'll be starting with the basic definition of the Cauda equina syndrome, and we'll try to understand कि Cauda equina है क्या. I hope we are all comfortable with a combination of English and Hindi. ठीक है. If anyone has any problem with any either of the languages, just let me know. ठीक है. So I think I'll be speaking in a combination of English and Hindi. दोनों में मैं बात करूँगा. Still अगर कोई issue रहता है तो मेरे को बता देना. ठीक है. Okay. So let's start with this. Okay. Okay. So first of all, I'll be basically discussing the basic definition of the Cauda equina. कि Cauda equina syndrome basically है क्या, and we'll be talking about the structure, the clinical anatomy or the basic structure of the Cauda equina, like how the Cauda equina looks and what are all the contents of the Cauda equina. Then we will jump over to its classification. Depending upon the various degrees of severity, we can talk about the different classification or different types of Cauda equina. Then we will jump over to the epidemiology. Okay, तो in between I'll be asking certain questions, but I just want कि जो आंसर अगर कर पा रहे हो आप कुछ इसके बारे में, I just want कि आप एक बार इसको ना अपने इसमें चैट बॉक्स में आप सेंड कर देना. आई वोंट बी टेकिंग नेम्स बिकॉज आई डोंट लाइक दैट, तो मैं नाम नहीं लूँगा. बट इफ़ एनी वन लाइक नोज द आंसर टू द क्वेश्चन आई विल बी आस्किंग, तो आप फील कंफर्टेबल टू सेंड इट इन द चैट बॉक्स. या फिर इसके अलावा इफ़ यू हैव एनी डाउट, एनी क्वेरी और एनीथिंग, just send it there, and meanwhile webinar के बीच में I will be taking those questions as well, और by the end of the webinar I will take those questions अगर आपका कोई doubt रहता तो. Okay, so okay, so we'll be talking about the epidemiology. I guess, can anyone tell me the meaning of the term epidemiology? मैं आगे बात करता हूँ, लेकिन if anyone can tell me the meaning of the term epidemiology in the chat box. Okay, ठीक है. Till then we'll move forward, and if anyone wants to give an answer to that question, that the meaning of the term epidemiology, like if we talk about the epidemiology of any condition, तो उसका basically मतलब क्या होता है, what is the meaning of the term epidemiology. Okay. After that we'll be talking about the clinical presentation, like if a person comes to us with Cauda equina syndrome, what is the clinical, like what are the things, what are the signs and the symptoms the patient will be showing. Then we'll be talking about the red flags, which is I think one of the most important things जो कि हमें जिसकी बात करनी है, not only in the Cauda equina syndrome but इसके अलावा in every condition. Let's say if you are इफ़ यू आर एन एम एस के फिजियो, तो इन दैट केस हमारे पास मोस्ट कॉमनली जो पेशेंट्स आते हैं, okay, Mansi, you're saying spread and control of disease. Yeah, okay, exactly. It means that the prevalence है ना, epidemiology means the prevalence of any condition, कि वो condition कितना ज़्यादा, कितना frequent है या कितना कम frequent है किसी particular area में, that is called as epidemiology of that condition. ठीक है? तो again, I just want कि without like having any look at the Google or something, epidemiology means the way of spread. द वे ऑफ स्प्रेड नॉट एग्जैक्टली शुभम, बट लाइक उसका उस कंडीशन का प्रेवलेंस कितना ज़्यादा है एक पर्टिकुलर रीजन पे. लेट्स से अगर हम बोलते हैं कि लेट्स से अभी बहुत कॉमन कोविड की अगर हम बात कर रहे थे, तो वी आर सेइंग कि कोविड इज़ लाइक इट वाज हाईली प्रेवलेंट इन सर्टेन कंट्रीज. जैसे अगर हम यूके की बात करें, वहाँ पे इट वाज हाईली प्रेवलेंट. कुछ कुछ कंट्रीज में इट वाज नॉट दैट मच प्रेवलेंट, है ना. तो ओके, तो इफेक्ट ऑफ particular disease or disorder in a particular community, its frequency cure, exactly वैष्णवी, है ना, कि वो कंडीशन कितना ज़्यादा फ्रीक्वेंट है कितना नहीं. ओके, कैन यू हैव अ रैंडम गैस, एक जस्ट एक रैंडम गैस कर सकते हो विदाउट हैविंग अ लुक एट द गूगल कि कॉडा इक्वाना सिंड्रोम का कितना प्रेवलेंस होगा. मतलब लेट्स से अगर हम ओवरऑल, अगर हम पूरे वर्ल्ड पॉपुलेशन की बात करें ऑफ द पेशेंट्स हु आर विजिटिंग द क्लिनिक्स, तो उनमें से कितना कितना प्रेवलेंस होगा, लाइक आउट ऑफ द टोटल नंबर ऑफ पेशेंट्स, 20%, 10%, 5%, 15%, 50%, कितना कितना प्रेवलेंस हो सकता है कॉडा इक्वाना का. व्हाट डू यू थिंक? स्पेसिफिकली आई एम टॉकिंग अबाउट द विजिटिंग फिजियो, जो विजिटिंग पेशेंट्स जो है, जो कि फिजियोथेरेपी डिपार्टमेंट में एंटर करते हैं, लाइक द पेशेंट्स हु आर एंटरिंग आइदर द ओपीडीज और द क्लिनिक्स और द हॉस्पिटल्स. सौरभ, यू आर सेइंग 2%. ओके, दैट इज क्लोज. ठीक है, तो ओके, तो विल बी टॉकिंग अबाउट दैट एज वेल. तो अभी हम देखेंगे कि इस कंडीशन का कितना प्रेवलेंस है. किसी को आइडिया है इंडिया में इसका कितना प्रेवलेंस है? अगर आप लोग सोचना इसके बारे में कि इंडिया में कितना प्रेवलेंस है, उसके बारे में भी हम बात करते हैं आगे जाके. बट ओके, यू आर सेइंग 1% इन, ओके, मे बी 5% अप्रॉक्स. नहीं, 10 तो बहुत ज़्यादा हो गया सैली, 10 तो बहुत ज़्यादा है. इतना तो नहीं है इस कंडीशन का प्रेवलेंस. ठीक है, चलो इस पर अभी हम आते हैं. नहीं, 4 भी नहीं है, 4 भी थोड़ा सा ज़्यादा हो गया. अभी अभी हम देखते हैं कि ये कंडीशन कितना ज़्यादा लाइक सेनेस्टर है, कितना ज़्यादा कितना वर्स है कंडीशन, एंड उसके अकॉर्डिंग फिर हम देखेंगे कि ये इसका प्रेवलेंस कितना होगा. ओके, तो आई थिंक वी आर क्लियर विद द टर्म एपिडेमियोलॉजी. देन विल बी टॉकिंग अबाउट द क्लिनिकल प्रेजेंटेशन एंड द रेड फ्लैग्स. हाँ, मैं रेड फ्लैग्स की बात कर रहा था. My voice is again breaking. क्या is it breaking for everyone? Okay, just give me a second then. Okay. Okay, I hope now it's better. Okay. Okay, I'm very much aware of this problem, because actually this problem is not with my internet. This is with the platform only, because I've been using this platform for quite a while now, and I know this problem is very much prevalent. This problem is very much prevalent with this platform. So, but I think it will be for a couple of times in the beginning. उसके बाद में it will become better. Okay, so we were talking about the red flags. So we'll see कि and in which conditions we are majorly supposed to talk about the Cauda equina syndrome, and like how much important is it to perform the red flag screening, है ना, या फिर हमें red flag screening कितना ज़रूरी है करना, इन उसमें स्पेसिफिकली कॉडा इक्वाना सिंड्रोम को हमें रूल आउट करना कितना ज़रूरी है, स्पेशली अगर हम लो बैक पेन के पेशेंट्स की अगर हम बात करते हैं. विल जंप ओवर टू दैट एंड talking about the symptoms and the causes and the physical examinations, like what are the scales of assessment which we can use, and इसके अलावा what are the other techniques which we can apply, है ना. तो ये सारी चीज़ों की हम बात करेंगे जो कि हम अप्लाई कर रहे होंगे on the patients with low back pain who will be showing certain symptoms of Cauda equina syndrome, and so as to figure out whether that person शुड हैव कॉडा इक्वाना सिंड्रोम और नॉट, है ना, कि मतलब उस कॉडा इक्वाना सिंड्रोम का प्रेवलेंस उस पर्सन में हो सकता है कि नहीं हो सकता ना, तो उसको फिगर आउट करने के लिए वी कैन गो फॉर द फिजिकल एग्जामिनेशन एंड इन द एंड विल बी टॉकिंग अबाउट द ट्रीटमेंट, द बेसिक ट्रीटमेंट ऑफ द कंडीशन. ओके, so let's start with the basic definition. Cauda equina syndrome. If we talk about the cauda equina syndrome, we can say majorly it is the compression of the cauda equina. And before that, if we are supposed to talk about the cauda equina, we can see ki just give me a second. Here, this is the whole structure of the spinal cord as well as the cauda equina. First of all, I think we all know this, that the spinal cord, it is the continuation of the brain stem, right? It is the continuation of the brain stem, and the spinal cord, it goes all the way up to T12 L1 region, or in some individuals it might go up to L1 L2 region, but in most of the individuals it goes up to T12 L1, है ना. So T12 L1 junction तक the spinal cord it ends, and after that we see there is this beginning of this bundle of all these nerves that is called as the cauda equina, है ना. तो cauda equina is basically this Latin word which literally means horse's tail, है ना. तो horse का tails, it resembles somewhat like the horse's tail, and that's why we call it as the cauda equina. Now, can anyone tell me in the comment box, in the chat box, like how many cranial nerve root, how many spinal nerve roots have we got? हमारे पास कितने spinal nerve roots हैं पूरे spinal cord में? How many pair of spinal nerve roots do we have? Exactly, we have 31 pair. हाँ, तो 31 pair is the exact answer, है ना. Not the 31 pair is the exact answer. ठीक है, तो it means we have got 8 cervical, then we have got 12 thoracic, then 5 lumbar, then we have got 5 sacral and 1 coccygeal. That adds up to make 31 pair, है ना. तो that is 31 pair of nerve roots emerging from the spinal cord. And if we have a look at the cross section of the spinal cord, हमें कुछ इस तरह का देखने को मिलता है स्ट्रक्चर ना. This is the cross section of the spinal cord, जहाँ पे we have cut the spinal cord along, what do you think, along which plane have we cut the spinal cord here? I think along the transverse plane, है ना. We have cut the spinal cord along the transverse plane so as to have a look at the cross section of the spinal cord. And here we can see we have got certain horns, है ना. These are the ventral horns जो कि anteriorly present है, and then we can see we have got these dorsal horns. So from the ventral horns we see that there are certain neurons, है ना, or certain nerves which are connected to the ventral horns, and then there are certain nerves which are connected to the dorsal horn, है ना. So eventually what we see that there are two types of nerves ना. There are these sensory nerves and the motor nerves. तो मोटर नर्व्स की अगर हम बात करते हैं, आई थिंक मोस्ट ऑफ अस आर प्रिटी मच अवेयर ऑफ द स्ट्रक्चर ऑफ द स्पाइनल कॉर्ड एंड द स्ट्रक्चर ऑफ दीज नर्व्स. तो हियर वी कैन सी, तो द मोटर नर्व इट इज सपोज टू बी द पार्ट ऑफ द डिसेंडिंग नर्व ना, बिकॉज नर्व जो है वो ब्रेन से आ रहा है, इट डिसेंड्स डाउनवर्ड अलॉन्ग द path along the course of the spinal cord, eventually comes out of the spinal cord, goes towards the effector muscle, है ना. एंड वहाँ पे of course it provides motor action, मतलब muscle contraction produce करने के लिए. तो that's why since this nerve it exits from the spinal cord, है ना, it is coming from the brain and it exits from the spinal cord. So E for exit and E for efferent. That's why this particular nerve root is called as efferent nerve root. And इसके अलावा दूसरे की अगर हम बात करें, the dorsal one, so that is called as afferent. It comes towards the dorsal nerve root. So that's why it is called as the sensory. So it is the sensory nerve, and it is also called as the afferent nerve root. So we can see that यहाँ पे हमारे पास एक left side पे and एक right side पे, तो we have got a pair of nerve roots at each level. ऐसे ही हमारे पास overall we have got 31 pair of nerve roots. तो we can see, चलो यहाँ तक तो हमें समझ आया कि till the spinal cord, यहाँ तक तो हमें समझ आ रहा है. But even in the cauda equina we can see this कि cauda equina में भी we have got a pair of nerve roots, and each nerve root में अगर हम देखते हैं, we have got a ventral nerve root and a dorsal nerve root. Ventral nerve root is for the motor control, and the dorsal one is for the sensory control. I hope we are all on the same page till here, है ना. So I think we have got an idea about the structure of the nerve roots. And apart from that, if we have a look at the cauda equina, we can say that the cauda equina it starts from L2 level. So till the L1 we can see हमारा spinal cord end होता है. At the level of L2 the cauda equina starts. It means from L2 all the way up to L5 हमारा cauda equina है. इसके बाद में from S1 to S5 and then the C1, because we have got one pair of coccygeal nerve root. So it means we can say from L2 to L5, then we have got S1 to S5, and then the C1. Okay, so it means overall we have got these 10 pair of nerve roots which are part of the Cauda equina. Okay, starting from L2 all the way up to C1, that whole is called as the Cauda equina. And of course the Cauda equina, again just like the rest of the spinal cord, it has got these ventral nerves or ventral neurons, along with that the dorsal neurons, you know? And we can say that the ventral neurons are for the motor control and the dorsal ones are for the sensory control. Okay, for the sense, for the sensation and all. So that's the basic structure of the Cauda equina. Along with that, we can talk about two different structures. One is the conus medullaris, and the other one, that is the phylum terminale. So the thing is that the lowermost part of the spinal cord at the level of L1, that particular region, or you can say the level or the region from where the Cauda equina starts, that is called as the conus medullaris. And the lowermost part of the Cauda equina, we can say we have got a fibrous band that extends like it goes downwards up to the level of sacrum, that is called as the phylum terminale. So we can say the lowermost part is called as the phylum terminale, and the uppermost part of the Cauda equina or the lowermost part of the spinal cord, that particular region, that part is called as the conus medullaris. Till now we have talked about the conus medullaris, the phylum terminale. We have talked about the pair of nerve roots, and we have talked about the nerve roots which are part of the Cauda equina from L2 all the way up to C1. These are all the nerve roots which are part of the Cauda equina, and the L1 that is supposed to be the part of spinal cord. So now, can anyone tell me? Just give me a second. Okay, yeah, exactly. It is transverse. Okay, so now can anyone tell me this, that like what I was asking? Huh? We talk about the upper motor neuron lesions and the lower motor neuron lesions. Like, what are the structures which are affected which lead to upper motor neuron lesion? कोई इन स्ट्रक्चर्स के नाम जो है वो चैट बॉक्स में लिख के भेज सकता है, लाइक व्हाट आर द मेजर स्ट्रक्चर्स? Exactly, Satvik. The brain and the spinal cord. It means if there is any injury to the brain or any injury to the spinal cord, that majorly leads to upper motor neuron, because these are the upper motor neurons, or the you can call them as the major neurons. That is the upper motor neurons. And of course, if there is any injury to the brain or the spinal cord, it leads to a condition that is called as upper motor, which falls under the upper motor neuron lesion. And eventually, because of that, we can talk about various different things which are the consequence of upper motor neuron lesion. Na? Like if we talk about, we can talk about spasticity. The spasticity increases. Likewise, we talk about the Babinski sign. We see that there is this positive Babinski sign. Along with that, we can talk about another term that is called as clonus. Exactly, CP. Yeah, CP can be an example of upper motor neuron lesion, where we can see that the brain is getting affected. Likewise, we can talk about spinal cord injury as well. So spinal cord injury में भी हमारा spinal cord जो है that is getting affected, and because of that we can say okay, okay, the CVA, exactly, CVA also. So these can all come under the upper motor neuron lesions. And likewise, if there is any injury to the nerve roots, जिस nerve roots की हम बात कर रहे थे यहाँ पे, these nerve roots है ना, कोई भी इंजरी अगर nerve roots पे हो रही है, और to the peripheral nerves, or even to the cranial nerves as well. So we have got 12 pair of cranial nerves na. So if there is any injury to the cranial nerves, any injury to these nerve roots, or any injury to the peripheral nerves, that will lead to lower motor neuron lesion. Okay, so we'll be talking about these things as well. So इसके अलावा, if we talk about the Cauda equina, if there is any injury or any compression or anything to the Cauda equina, that will also lead to this lower motor neuron lesion. Okay, that will also lead to lower motor neuron lesion. So it means if there is a lower motor neuron lesion because of any injury to the Cauda equina, because of that, will the spasticity, like will the muscle tone increase or decrease? What do you think? You can just write it down in the chat box. It will become flaccid, है ना? The muscle tone, it will decrease. We'll be talking about, exactly, it will decrease, है ना? Likewise, yeah, exactly, in polio and all these conditions, so it will decrease. Likewise, if we talk about clonus, okay, let me just show you कि clonus होता क्या है. Clonus is basically, first of all, the thing is कि In case of upper motor neuron lesion, we talk about all these things. Now we talk about increased spasticity, we talk about clonus, we talk about Babinski sign, है ना? We talk about increased reflex, है ना? Deep tendon reflex, that is called as hyperreflexia. So the thing is that if we are talking about clonus is basically like if we give any kind of stretch reflex to a muscle. Let's say मुझे कोई upper motor neuron lesion हुआ है जिसकी वजह से my this particular part, this arm is getting is affected because of upper motor neuron lesion. Now if you keep this wrist in this extended position continuously, है ना, या फिर you can say कि अगर आप flexor muscles को continuous stretched position में रखते हो, तो in that case after some time we'll get to see कुछ हमें ऐसा vigorous contraction relaxation देखने को मिलेगा, ठीक है. This vigorous shaking हमें देखने को मिलेगी in patients with upper motor neuron lesion, ठीक है. I am saying कि if you keep a particular set of muscles under sustained contraction in patients with upper motor neuron lesion under sustained contraction, in a matter of 1 or 2 minutes you will get to see आपको क्लोनस देखने को मिलेगा. दैट इज दिस अनकंट्रोल्ड विगरस कॉन्ट्रैक्शन ऑफ द मसल्स, ठीक है, विगरस शेकिंग ऑफ द मसल, that is called as clonus. So if the person shows clonus, it means that the person is supposed to have an upper motor neuron lesion. So of course we can say कि if let's say if there is injury to the cauda equina, that is a lower motor neuron lesion, so in that case the clonus should be absent, है ना. There should not be any clonus in the patients with cauda equina syndrome, ठीक है. Likewise we can talk about muscle tone, so it means that the muscle tone is supposed to decrease in patients with cauda equina syndrome. We can talk about the reflexes, है ना, the deep tendon reflex. We can mainly test the ankle reflex. Ankle reflex, it is majorly related to the S1 S2 region. So S1 S2 nerve root से related है. And again if there is any injury to that particular part or the cauda equina as a whole, so in that case we can say that the ankle reflex will also get affected. It will be decreased because the cauda equina syndrome resembles the lower motor neuron lesion, not the upper motor neuron lesion, okay. And so I think more or less we are clear with the structure of the cauda equina, and I think we have talked a bit about the nerve roots, and we have talked about the condition or the things that we can get to see in cases with cauda equina syndrome, okay. Let's see what cauda equina syndrome exactly is. So we can see majorly there is this significant narrowing of the spinal canal, and so we know that through the spinal canal it passes, and the spinal cord and eventually the cauda equina, and we see that if there is any narrowing of the lumen, any narrowing of the structures because of which eventually the cauda equina, if it gets compressed, so in that case we can say that person has got this cauda equina syndrome. Now there can be various different reasons for the compression of the cauda equina. There can be this metastatic cord compression, that is it means that there might be any presence of metastasis, है ना, or there might be any presence of this unusual cell growth, या फिर कोई tumor formation हो सकता है which can lead to the compression of the cauda equina. Apart from that there can be another reason, which is that there can be any fracture of the vertebral structures, ना, vertebral structure का fracture हुआ, and because of that now there is this compression of the cauda equina, that can again lead to cauda equina syndrome. There might be the presence of TB, that is tuberculosis. So there can be various different reasons which can lead to this cauda equina syndrome. We'll be talking about that. But eventually if there is any compression of the cauda equina, that leads to the cauda equina syndrome. Now what happens because of that? Now we can see that it is a very rare condition. जैसे अभी हमने discuss किया that just आपने कुछ examples बताए थे, 2% 1% कुछ ऐसे आपने बताया था, अभी उसकी भी हम बात करेंगे. लेकिन it is one of the most rarest condition, but at the same time most sinister condition as well. If you get to see any patient with lower back pain, and if the person is showing the signs of cauda equina, तो in that case definitely you need to go for the proper screening. आपको red flag screen करना बहुत ज़रूरी है, and at the same time you need to go for the physical examination as well. And if the person shows positive results for the physical examination for the cauda equina, of course you need to rush the patient to any general practitioner or to maybe to a surgeon, है ना. Can anyone tell me like what is how much time have we got for a person with cauda equina symptoms? Like जो golden period हम कहते हैं, कितना टाइम होता होगा? What do you think? Yeah, infection. Namrata, yeah, exactly. It can be because of infection as well. किसी को idea? Like how much time have we got for a person, 48 to 72 hours exactly. Like more or less we take 40 to 48 hours, but it can go up to 72, but more or less we take it as 48 hours. So maximum we have got this 48 hours of time. तो अगर 48 hours के अंदर if the person has gone for any kind of surgery for the Cauda equina syndrome, so in that case still that person can still um, uh, like preserve a lot of these sensations and motor functions. लेकिन अगर हमने वो time खराब कर दिया, तो in that case the person won't be able to regenerate those things, those sensations and those functions. इसका मेजर रीज़न क्या है? लाइक अनलाइक द रेस्ट ऑफ द नर्व्स, अगर हम बाकी नर्व्स की बात करते हैं, वी सी दैट वी हैव गॉट दिस माइलिन शीथ which is present on the rest of the nerves and neurons. But if we talk about the Cauda equina, we don't have any myelin sheath on the Cauda equina, and that is again one of the reasons why Cauda equina is one of the most susceptible nerve to injury, and the reason why it doesn't regenerate that quickly, that fast, just like the rest of the nerves जो कि हमें बाकी बॉडी में देखने को मिलता है, उतना फास्ट नहीं. एंड दैट इज़ द रीज़न, लाइक अगर हमें कॉडा इक्वाइनस सिंड्रोम के पेशेंट में कोई भी बॉवल ब्लैडर या कोई भी सेंसेशंस या मोटर फंक्शन अगर अफेक्टेड मिलते हैं, तो देर इज़ अ वेरी लेस चांस कि दैट इफ दैट लाइक दैट पर्सन विल रीजनरेट दोज सेंसेशंस एंड दोज मोटर फंक्शंस अगेन इन द लाइफ, है ना. So it means that it is one of the most sinister conditions, you can say, the Cauda equina syndrome. Okay, so now we can see because of Cauda equina syndrome there are all these things that we can talk about, that the Cauda equina provides innervation for the lower limbs, mainly the perineal region, the perineum region, na? Or we call it as the saddle region, the medial side of the thigh, है ना, and the perineum. Along with that, we can say that it provides its action or its motor control for the sphincter as well. The sphincter, which one? For the anal sphincter, and for all these, for the skin region of the perineum and all that. Okay, we'll talking about that in a bit. And along with that, we can see that most common cause of Cauda equina syndrome is supposed to be the prolapsed intervertebral disc. Most commonly, it is because of the this thing, the PIVD. But along with that, as I've said this, that it can be because of this metastatic cord compression, it can be because of TB, it can be because of fracture, it can be because of various other reasons as well. Okay, and along with that, we can see that if we have any patient with acute back pain, you know, and if the person is saying that the person has this disturbed bowel and bladder function, or if the person complains of having disturbed sensation in the perineum region, है ना, अगर वहाँ पे sensation अगर disturbed बोल रहा है, और if the person says कि अगर person को urinate करने के time पे the person needs to like put force, person को काफ़ी strongly bladder को contract करना पड़ता है ताकि person urinate कर पाए. Or if the person says that there is no control on the bowel movement, है ना, bowel movement पे control नहीं है person का, या इसके अलावा if the person complains of sexual functions getting affected as well, like if the person is having diminished sexual functions as well, so we'll be talking about that as well. So again we need to screen the Cauda equina syndrome, ठीक है. Okay, so I think we have talked about a bit about the basic anatomy of the Cauda equina, and we have discussed the definition of the Cauda equina. Let's jump over to the clinical anatomy of the Cauda equina. We can see that it starts from the L1 region, mainly the L2 up to C1, that all comprises of the Cauda equina. We have seen this thing, that we have got these dorsal and the ventral roots, दोनों हमारे पास present है. And the dorsal and the ventral root is for the motor function, and the dorsal root is for the sensory function, just like this structure जो कि हमने यहाँ पे देखा था. The ventral root, this is for the motor function, and the dorsal one is for the sensory function. Just like that, we can see even in the Cauda equina, the ventral and the dorsal roots. So we can see that the ventral roots provide motor function, and these are also called as efferent pathways, just the way we saw it here, है ना. So these were the efferent nerves जो कि exit कर रहे थे, which were exiting from the spinal cord or from the Cauda equina, and these are the sensory ones, these are the afferent जो कि which are coming towards the spinal cord or towards the Cauda equina. So these are the afferent, the sensory ones, and the efferent, which are the motor nerves. इसके अलावा there is another term that is written here, that is the sympathetic fibers. So we know this ना कि the sympathetic and the parasympathetic nerves, these are the part of autonomic nervous system, है ना. We talk about the central nervous system and the peripheral nervous system, then we see that we have got this autonomic nervous system, in which we talk about the sympathetic and the parasympathetic. And I think we are all aware of the thing that the sympathetic nervous system is majorly for fight and flight situation, na. So in case of fight and flight situation, we see that there is this activation of the sympathetic nervous system, है ना. तो sympathetic nervous system का काम क्या होगा? It will try to increase the amount of blood supply in the lower limb, है ना, so that we can just run, or it will try to increase the heart rate, है ना, so that the heart is able to pump more amount of blood. It will try to dilate the pupil so that we can have more amount of light in the eyes so that we can see better. On the contrary, on the like the opposite one is the parasympathetic nervous system, which is for rest and digest. It means during the time, like when we are resting, when we are not doing performing any like much of the strenuous activities, in those cases we can see that there is this activation of parasympathetic nervous system, which performs the exact opposite actions of the sympathetic nervous system. Okay, so we can see the sympathetic fibers, these are also originating from the cauda equina. So the thing is that अगर हम origination की बात करते हैं of the sympathetic fibers and the parasympathetic, so we say that sympathetic fibers again they are originating from the spinal cord only. They are originating from the spinal cord only, and they originate from the thoracolumbar region. Just you can even note it down अगर आपको इसका idea नहीं था, that the sympathetic fibers, sympathetic nerve roots along with the rest of the nerve roots, बाकी nerve roots के साथ में even the sympathetic fibers जो है which are for fight and flight situation, they originate from thoracolumbar region of the spinal cord. तो चलो thoracic region का तो कोई लेना देना नहीं है with the cauda equina, but lumbar region का तो है from L2 to L5. So it means the L2 to L5 the nerve roots है, they are part of the cauda equina, and if there is any injury to the cauda equina, that might also affect the sympathetic nervous system or the sympathetic functions of the person. On the contrary, अगर हम बात करते हैं of the parasympathetic nervous system, it originates from craniosacral region, from the cervical nerve roots and from the sacral region. So from the cervical and from the sacral, the origination is for the parasympathetic nerves, and from the thoracic and the lumbar segment we can see there is origination of the sympathetic nerve fibers along with these nerve roots. So I think we are clear with this thing. The ventral nerve, so it means that the cauda equina, it has got both the ventral nerve roots and the dorsal nerve roots as well, and because of that we can say that the cauda equina, it provides both sensory functions as well as motor functions as well. Okay, so the sensory functions along with that the motor functions. Okay, so as a continuation of that, so since now till now I think we are all aware of the basic anatomy of the spine of the cauda equina. We are well aware of the basic definition of the cauda equina syndrome. So now let's jump over to the classification of the cauda equina syndrome. So we can see that here it is there we have got four different types of, or you can say that we have got four classifications of cauda equina syndrome depending upon its severity. So the first one, that is the CESS, that is the cauda equina syndrome suspected. That is the basic level of cauda equina syndrome, where we can see that the symptoms are not that much, and or you can say कि we can suspect the presence of cauda equina syndrome in those patients now. The next one is the cauda equina syndrome incomplete. After that it comes the cauda equina syndrome retention and the cauda equina syndrome complete. Okay, so now let's start with the cauda equina syndrome suspected. First of all, suspected means that we it is not like just give me a second. We are not sure that the person is having the cauda equina syndrome or not, but at least till now we can suspect the presence of cauda equina syndrome, you know. So we can, if the person is complaining of all this sexual function getting affected, or we can say the person is complaining of bowel bladder functions getting affected, even the erectile dysfunction, we can talk about that as well. If the person is complaining of erectile dysfunction, if the person is complaining of this saddle anesthesia in the medial side of the thigh and in the perineum region, so we can say that that is the cauda equina syndrome suspected. We have suspected the condition, but we have not done the physical examination, and we don't exactly know कि क्या cauda equina exactly अभी present है कि नहीं है, but at least it is suspected. The next one that comes here, that is the incomplete, the cauda equina syndrome that is incomplete, CESI. So here what we can see, that now the person is having a bit of this this decreased desire to void. Void means to मतलब खाली करना, ब्लैडर को खाली करना, that is called as void, है ना. So the person is having difficulty to void the bladder, and at the same time we can say that the person is having these urinary difficulties, है ना. So in that case we can put it under cauda equina syndrome incomplete. The next one is the retention one. The retention, the Cauda equina syndrome retention. It means that here the like the person is no longer able to feel pain, है ना. तो यहाँ पे Cauda equina syndrome incomplete में हम देख रहे थे. Still the person was having difficulty in urinating, है ना, because the person was not able to contract the bladder properly. Because of that, the person was having this difficulty in avoiding the bladder or to urinate, but that was painful. But in the retention, in the Cauda equina syndrome retention, here we can see it is like it is not painful anymore. Now it is not pain. It means that the sensory functions are also like have been affected. And the end one, that is the Cauda equina syndrome complete, it means that along with the urinary functions, even the bowel function has also got affected. ठीक है, मतलब पर्सन का bowel control भी affect हो गया है, and along with the sensory, with the urinary function. And इसके अलावा there is all this absence of sensations in the perineal region, and there is this paralyzed bladder and bowel functions. Okay, there are two different things. When we talk about the bowel function, for the bowel movement, we see कि वहाँ पे sphincter present होता है. We have got this a couple of sphincters. Sphincters are basically these circular shaped muscular structures which we call them as sphincters, जो कि anal region में present होते हैं. So now the thing is कि as we see that there is this movement of the bowel from the proximal part of the alimentary canal to the distal part of the alimentary canal, है ना. मतलब कि हमारा पहले colon वाला region होता है, ascending transverse and descending colon, then comes the rectum, है ना, large intestine में, and then comes the anus. So we say that in the anal region, like when there is this movement of the bowel, so there are these circular shaped sphincter or these muscles which are under contraction, है ना, जो कि continuous contraction में है, and which have closed the anal region, so that there is no movement of the bowel outside the anus region, huh? And when we go for, like when we go to poop, so in that case we see that there is this relaxation, है ना. जब भी whenever the person poops, there is this feeling of relaxation. So it means that the sphincters, they relax, and after that the person is able to pass the stool, है ना, the bowel. इसका opposite we can see in the movement of the urine. So in case of urine, we see there is this filling of the urine inside the urinary bladder, ना. तो urinary bladder के अंदर urine it gets filled, and eventually of course we have got this stretch reflex and sensations and all that, जिसकी वजह से we see कि we get this feeling कि वहाँ पे the bladder जो है it has become full, and इसके बाद में there is this proper contraction of the bladder, because of which there is this passing of the urine that we can perform. तो यूरिन को पास करने के लिए वी नीड टू हैव अ प्रॉपर कॉन्ट्रैक्शन ऑफ द ब्लैडर, लेकिन स्टूल पास करने के लिए वी नीड टू हैव अ रिलैक्सेशन ऑफ द स्फिंक्टर्स. तो दैट इज द रीजन वाई वी सी दीज टू डिफरेंट अपोजिट थिंग्स. अगर हम दोनों केस की बात करते हैं, इन केस ऑफ कॉडा इक्वाना सिंड्रोम, कॉडा इक्वाना सिंड्रोम में देर इज लोअर मोटर न्यूरॉन लीजन ना, तो देर इज फ्लैसिडिटी ऑफ द मसल्स. तो सिंस द मसल्स हैव बिकम फ्लैसिड, तो एनल स्फिंक्टर की अगर हम बात करें तो एनल स्फिंक्टर बिकम्स फ्लैसिड, एंड बिकॉज ऑफ दैट इट इज नॉट एबल टू कॉन्ट्रैक्ट efficiently, and because of that there is this uncontrolled movement of the bowel, and because of that the person has no control over the bowel movement anymore. And on the contrary, if we talk about the passing of the urine thing, तो उसमें हम क्या देखते हैं, we need to have a proper contraction, and since the person has lost the contraction of the bladder, now the person needs to person will try to contract the bladder, है ना, या फिर person will try to put force and ताकि person urine pass कर पाए, but still the person is not able to pass the urine. That is because the bladder has lost its motor function ना, जो उसको contract करने का function था वो loss हो गया, and that is the reason why we see there is retention of urine, कि person is not able to pass urine, but at the same time there is uncontrolled bowel movement. Bowel को पर्सन कंट्रोल नहीं कर पा रहा है, बॉवल मूवमेंट अनकंट्रोल हो रहा है. लेकिन अगर हम यूरिन की बात करते हैं, यूरिन रिटेंशन हो रहा है, यूरिन रिटेंशन में पर्सन को प्रॉब्लम हो रहा है. ठीक है, तो देयर आर दीज टू डिफरेंट अपोजिट थिंग्स विच वी कैन टॉक अबाउट इन केस ऑफ कॉडा इक्वाना सिंड्रोम. बट आई होप वी आर ऑल क्लियर with the basic these four different types of Cauda equina syndrome, starting from suspected and going all the way up to the complete type of Cauda equina syndrome. Okay, let me have a look here. Okay, ठीक है. If you guys have any doubt, just type it down in the chat section. Okay. Okay. Now, okay, we have talked about the basic structure of the Cauda equina. Now we can see here. टॉकिंग अबाउट द एपिडेमियोलॉजी, एज यू गाइस सेड दिस, कि आपने जैसे बताया कि एपिडेमियोलॉजी ऑफ अ कंडीशन मीन्स दैट कि वो कंडीशन कितना ज़्यादा प्रेवलेंट है, एक किसी एक पर्टिकुलर रीजन की अगर हम बात करें तो वो कितना ज़्यादा प्रेवलेंट है, और वी कैन से कि किसी पर्टिकुलर कॉज की वजह से वो कितना ज़्यादा प्रेवलेंट है वो कंडीशन। लेट्स से जैसे हमने यहाँ पे देखा कि there were different causes, different reasons for cauda equina syndrome. Eventually there is this compression of the cauda equina, लेकिन वहाँ पे like is it because of disc herniation, is it because of this metastatic cord compression or tumor, is it because of any vascular problems, or is it because of any other condition? So this has been seen कि 72.7% of the cauda equina syndrome, मतलब majority of the cauda equina syndrome has been seen because of disc herniation. What about the urethral sphincter, you are saying? Okay, there are these urethral sphincters there which are present there, but actually like I am right now talking about the process of this getting rid of the urine, na? Of getting rid of the urine. So, so for that we can say we need to have a proper contraction of the urinary bladder, है ना? So we need to have a proper contraction of the bladder, then only we can get rid of the urine. Okay, ठीक है, तो वी वर टॉकिंग अबाउट दिस दैट देर इज majorly there is this disc herniation which leads to 72.7% of cauda equina syndromes. So if a person comes to you with maybe with this PIVD condition, or if you diagnose that there is presence of this disc herniation in a person, or of PIVD in a person, and if the person complains of all these things which we see in the cauda equina, na, all these diminished sensations and all these functions, so there is a chance that there might be any prevalence of cauda equina syndrome, and we need to go for a proper physical examination in that person. Okay, likewise we can see that we have got this tumor that comprises of 13.6% of the total cauda equina cases. Along with that we can talk about these vascular problems as well, like there can be any condition with the blood vessels, you know, with the blood supply, and because of that again we can say that the cauda equina gets affected, and that leads to, that comprises of 4.5% of the total cauda equina cases. Okay, so majorly it is because of the disc herniation, and then we can say likewise it can be that is followed by tumor, and that is eventually followed by the vascular problems. And this information has been taken by this website, you can just check it out, that is this PubMed Central, na? So I've went through this case study and I saw this ki there is this prevalence of these reasons for cauda equina syndrome. You can just go through this. This is present there in the handbook जो आपको मैंने provide करी है. Okay. Okay, so we can see here कि majorly it is because of the disc herniation or the tumor or the vascular problems. Apart from that, we can see there can be other reasons as well. There can be any kind of this bacterial infections which can lead to this abscess formation, na? This abscess formation in the on the vertebral structures, or maybe in the near the cauda equina, which can eventually lead to the compression of the cauda equina. Or there can be this epidural hematoma, the spinal epidural hematoma. There is this blood clot formation which can eventually lead to compression of this thing, now of the cauda equina. Or there can be discitis, which we have talked about. Discitis means the inflammation of the disc, or the tumor, again we have talked about that. And apart from that there can be this trauma as well. So trauma means if there can be any fracture of the vertebral structures, and because of that vertebral structure can eventually lead to the compression of the cauda equina. So it means that there might be any retropulsion of the bone fracture, of the fractured segment, which can lead to the compression of the cauda equina. And there can be this congenital condition of spinal stenosis as well. Might be the person might be having this spinal canal जो कि congenitally, which is like there is not much of the space in the spinal canal, so which can again lead to the compression of the structure. Okay, so there can be all these reasons, but the major reasons can be the disc herniation, the tumor, and this trauma. Okay, and okay, so I think we are all clear with the major problem or the major causes for the cauda equina and the prevalence of these causes. Along with that we can talk about the regions, like अलग अलग regions की हम बात कर सकते हैं, अलग अलग regions पे कहाँ पे ये condition का prevalence ज़्यादा है. Like we can talk about this कि in UK it has been seen that only 1 to 3 of the total visiting patients, जो कि visiting patients मतलब हमारा total number of visiting patients की अगर हम बात करते हैं, out of those per this has been seen कि only 1 or 2 3 of those have been diagnosed with Cauda equina syndrome. Likewise in USA we can see this कि because of this disc herniation जो कि major cause है of Cauda equina, because of that only 0.12% of patients have been diagnosed with Cauda equina syndrome. So it means there is like not much of the prevalence इस condition का. Even अगर हम यहाँ पे भी calculate करना चाहे तो we can calculate by it by dividing 3 by 1 lakh. कितना होगा? Can anyone calculate that? 3 by 1 lakh. Just give me a second. 3 by 1 lakh, that comes out to be this much, and that is multiplied by 100. It means that just 0.003. So it means there is this less of the prevalence of Cauda equina syndrome in these countries or in these regions, but still they are trying to diminish it कि मतलब ये इस छोटे नंबर को भी ये कम करना चाहते हैं. But if we talk about India, in India unfortunately, at least I was not able to find any kind of documentation related to Cauda equina syndrome. Specifically अगर हम physios की बात करें, like we are not documenting the cases of Cauda equina syndrome, and because of that we don't know actually कि Cauda equina syndrome के cases India में कितने present है. But we have the documentation for these cases in USA and in UK as well, and in other countries also. So look, we can't talk much about that thing in India, but okay, so we can see that, but keeping in mind कि in countries में इस condition का prevalence काफ़ी कम है, तो we can say that इस condition का prevalence India में भी even काफ़ी कम होगा, but still we don't know much about that कि कितना कितना prevalence है इस condition का, exact जो numbers है we don't know much about that. But okay, so till now we have talked about the prevalence of this condition in different regions and the prevalence of this condition because of different causes, because of different reasons. ठीक है? Okay, now coming up to the clinical presentation of the patients with Cauda equina syndrome. So now we can see, first of all, like if any person comes, if a patient comes to you with low back pain, or if maybe with this pins and needles, so in that case, of course, for sure you need to go for the screening of the Cauda equina syndrome. You need to go for all the mandatory tests and all these things that we need to go for the testing of the Cauda equina. So here we can see that if the person is showing this bilateral neurogenic sciatica, it means there is this sharp shooting or pins and needles all the way along the leg, है ना, and पूरे leg में if the pain is spreading along the back side of the leg, that might be a clinical presentation of Cauda equina. So if the person comes to you and the person is complaining this thing, that the person is showing this radiating pain along the back side of the leg, so you must go for the screen, at least go for the screening of the Cauda equina, or at least just ask them कि if they are having any kind of urinary retention or any kind of change in the movement patterns of bowel and bladder, है ना, or if they have felt any kind of like loss in the sensation in the perineum region. So you need to ask these questions in cases with low back pain, or maybe in cases with hip joint pathologies, है ना. अगर कोई यहाँ इस एरिया के आसपास का कोई केस लेकर आता है तो you need to figure out, आपको ये questions पूछना ज़रूरी है. Apart from that, we can see, of course, there is this reduced perineal sensation. Of course, we have talked about that. There is this altered bladder and bowel. So this moment, and we can see that altered bladder function leading to painless retention. So we can see this कि this condition arises in the third type of Cauda equina. जो हमने third type की बात कर रही थी, that is CESR, that is Cauda equina syndrome retention. So in this case here we can see there is this retention of the urine. The person is not able to void it properly, and along with that it is painless. यहाँ पे अगर हम incomplete की बात कर रहे थे तो patient was still saying कि यहाँ पे the person is not able to void the urine, but still it is painful. मतलब person के लिए painful है condition. But when it becomes painless, it means that the condition has become much worse. And here we can put this condition under the Cauda equina syndrome retention. That is the third type of Cauda equina syndrome, which is much worse than than the rest of the two. Okay. Along with that, we can see there can be altered bladder function, which is painless. Okay, we have talked about that. And then there can be this loss of anal tone, because the Cauda equina syndrome is again a lower motor neuron lesion. So it means there is this decreased amount of flaccidity, and because of that, we can see around the anal region, the muscles, they lose their tone. Muscle tone जो है decreases, or the muscles they become flaccid. And then we can say that there is this loss of sexual functions as well. The person might complain of a loss in the sexual functions also. Now the thing is, just give me a second. Yeah, okay, port spine and narrowing, we'll be talking about port spine as well, इस पे भी हम अभी आते हैं थोड़ी देर में. um, okay. I just want you guys to just understand the severity of this condition. Actually, there was a this case actually happened in UK. Actually, London में एक case हुआ था. There was an Indian physio like who was practicing there as a physio, and he came across this case of Cauda equina syndrome. So actually, it was not diagnosed. The patient came with low back pain, and the patient complained कि low back pain है, and it is radiating all the way along the legs. So of course that the person, the physio, he didn't went through the proper screening, and after like this 48 and 72 hours, the condition became much worse. And after that, like the person lost their this sensation and the bowel bladder functions and all that, even the sexual functions and all that. And the person sued that physio, and the जो case है वो अभी भी चल रहा है उस physio के ऊपर. द थिंग इज, जो कि मैं बताना चाह रहा हूँ कि जस्ट ट्राई टू अंडरस्टैंड दिस फ्रॉम द पेशेंट्स पॉइंट ऑफ व्यू, कि जब वो पेशेंट जब वहाँ पे मतलब उस पेशेंट को लाइक दैट, उस पर्सन की जो एज है, उस पेशेंट की जो एज है, दैट वाज जस्ट आई थिंक 34-35. जस्ट ट्राई टू अंडरस्टैंड कि कितना यंग इंडिविजुअल है, एंड द पर्सन हैज लॉस्ट द बॉवल ब्लैडर फंक्शंस, एंड इसके अलावा द पर्सन इज नॉट एबल टू एन्जॉय द सेक्शुअल फंक्शंस एज वेल, इसके अलावा एट सच अ यंग एज. तो वो लाइक it has become such a devastating condition for the individual, and the worst thing is that the person can't even get this condition get like fixed, है ना. ये condition ठीक भी नहीं हो सकती. At max we can go for the management, हम management कर सकते हैं, लेकिन the condition can't be fixed, है ना. So that is the severity of the condition, and that is the responsibility of us ना, like we physios. अगर हमारे पास कोई low back pain का case आता है, there is a chance कि there might be presence of Cauda equina syndrome. with we need to go for the रेड फ्लैग स्क्रीनिंग. तो कितना कितना इंपॉर्टेंट है रेड फ्लैग्स को रूल आउट करना, वो हम यहाँ से हमें समझ आ सकता है. ठीक है, ओके. तो ठीक है, इंडिया में इतना हम लोग ध्यान नहीं देते हैं, यहाँ पे पता नहीं कितने केसेस मिस आउट हो गए ऑफ कॉडा इक्वाना सिंड्रोम जो लो बैक पेन लेकर आए थे. लेकिन वी नीड टू अंडरस्टैंड द रिस्पॉन्सिबिलिटी ऑफ रूलिंग आउट द रेड फ्लैग्स इन पेशेंट्स विद लो बैक पेन और इन with hip joint pathology or any condition related to that particular region. Okay. So okay, so these are all the clinical features or clinical presentation of the Cauda equina. Now let's talk about the red flags, which is one of the most important things that we can see here. So if let's say if a person comes to you with low back pain, let's say, है ना, and the person is complaining of this radiating pain, इसके अलावा person कुछ और complain नहीं कर रहा, so you need to ask the person like you need to go for the testing of the sphincter tone, है ना. तो we need to see कि वहाँ पे like as for dermatome की अगर हम बात करते हैं, like if there any is there any like loss of the sensation or loss of any even motor function उस particular region में, is there any kind of bladder retention, urinary retention या bowel incontinence, है ना. क्या उस we need to ask the person कि क्या उस person में bowel incontinence, if the person is not able to, is the person not able to control the bowel movement, or is there any difficulty or any kind of pain while voiding the urine, है ना, यूरिन पास करने के लिए टाइम पे, और इफ देर इज एनी काइंड ऑफ डिस्टर्बेंस ड्यूरिंग गेट एज वेल, लाइक वी कैन सी इवन गेट में भी अगर कोई डिस्टर्बेंस अगर हमें देखने को मिल रहा है, और इज देर एनी काइंड ऑफ पिंस एंड नीडल्स ऑल द वे अलॉन्ग द लेग्स एंड स्पेसिफिकली लोअर लिम्ब की तरफ इवन बिलो द नीज, इज देर एनी काइंड ऑफ सैडल एनेस्थीसिया. सैडल, द टर्म सैडल एग्जैक्टली मीन्स, जो सैडल टर्म आया है ये एग्जैक्टली हमारा जो हॉर्स के ऊपर जो वो सीट होता है ना, उसको हम सैडल कहते हैं ना. एंड उसके ऊपर when we sit, तो we say that the saddle region of our body is this region जो कि हमारा perineum है, along with that the medial part of the thigh that is called as the saddle that is called as saddle region. Likewise we can say कि saddle joint की भी हम बात करते हैं, तो saddle joint is again something like this ना, कि जहाँ पे एक बोन जो है that shows this saddle type of junction, एंड इसके साथ में दूसरा बोन जो है it gets attached, it gets fixed with this, है ना, that is called as saddle type of joint. Likewise we can say that saddle anesthesia, it means that the saddle region, that is the medial side of the thigh and the perineum. ठीक है, तो that the term has come from the saddle, जो कि हॉर्स के ऊपर यूज़ किया जाता है सैडल. ठीक है, वहाँ से ये टर्म निकल के आया है, तो सैडल एनेस्थीसिया. ठीक है, तो इज देयर एनी काइंड ऑफ लॉस ऑफ सेंसेशन in this particular region, and इसके अलावा is there any kind of sexual dysfunctions as well, like is there any kind of erectile dysfunction, is the like we can of course ask this question in the males, है ना, कि like if the penis is it flaccid, or like if the person is able to make it erect or not, है ना? Is the penis getting erect or not, or is it flaccid continuously after the prevalence of low back pain, जब से person को low back pain आया उसके बाद में, or is there any presence of dyspareunia? Dyspareunia basically exactly means there is this like a high amount of pain in the genitals or in the lower region, especially before any kind of sexual intercourse or maybe after any kind of sexual intercourse. And specifically this condition can be seen in females, and that is majorly because of improper lubrication of the vaginal region. So if there is this improper lubrication of that region, because of that there is painful intercourse, and because of that the person might have a lot like this high amount of pain in that particular region, है ना? And that is called as dyspareunia. So there might be presence of dyspareunia, there might be presence of erectile dysfunctions, and that can be because of that can show this sexual dysfunction, and that can be because of this Cauda equina syndrome. So if the person is showing any these kind of symptoms, है ना? So in that case we need to say that okay, it means that the person is showing these red flags, and we definitely we need to refer the person to any other specialist or any general practitioner or maybe any surgeon जो कि इस condition को better manage कर पाए, ठीक है? That is the red flag. And there is another thing. There are basically two terms. One is the red flag and another one is the white flag. तो red flag I think यहाँ इस जगह पे red flag books में जो term use किया हुआ है थोड़ा सा गलत तरीके से use किया हुआ है. The thing is कि like in cases like Cauda equina syndrome, yeah, even in the conditions which are more sinister, like we can talk about like conditions like cancer, है ना, or like tumor or these conditions. तो उन cases में we can say those are not even the red flag, they are completely white flag. White flag means war में हम white flag अगर निकालते हैं, it means कि जस्ट हमने हथियार छोड़ दिए, हमने बस बिल्कुल छोड़ दिया, and we need to refer the person to any other specialist, है ना? तो that is the white flag. तो basically these are the white flag conditions. And then there comes the red flag जहाँ पे we are at least going for the screening and all that, and उसके बाद में we are referring the person further, ठीक है? That is basically the red flag. Okay, so we need to rule out these red flags to so as to figure out whether the person is having Cauda equina syndrome or not. And then because of that we can see that there can be prevalence of all these things which we have talked about. There can be this sexual dysfunction, bladder dysfunction, there can be this saddle anesthesia. We have talked about all these things that can be seen as symptoms of Cauda equina syndrome. There can be this decreased amount of deep tendon reflex, है ना, specifically for the ankle reflex that comes from the S1 S2 region, ठीक है? So that there is this decreased amount of sensation. So all the these signs, sorry, all the symptoms which we see in relation to the lower motor neuron lesion, we can talk about all those things when we are seeing the Cauda equina syndrome, है ना? And there is one more thing. Let's say if a person comes to you, the person might have undergone any kind of this road traffic accident, or there might be any other condition. Let's say जैसे आपने port spine बताया, तो there might be any kind of port spine or any other thing that might be present. So how to rule out ki whether that thing is compressing the spinal cord, or is it compressing the Cauda equina syndrome? So for that we need to figure out whether the person is showing the symptoms of upper motor neuron lesion or the lower motor neuron lesion, है ना? तो अगर person upper motor neuron lesion के symptoms show करता है, like if there is any increased amount of muscle tone, if there is spasticity, if there is clonus that is present, if there is hyperreflexia, increased amount of muscle reflex, you know, there is positive Babinski sign, so then we can say that of course in that person there is the spinal cord that is affected and not the Cauda equina. And on the contrary, if the person doesn't show the symptoms of upper motor neuron lesion, and इसके अलावा if there is flaccidity, है ना, there is decreased amount of muscle tone, इसके अलावा if there is a decreased amount of ankle reflex, so in those cases we can say that shows this lower motor neuron lesion type of condition, and in that case there is a high chance that the person might be having sorry, that the person might be having Cauda equina syndrome and not the spinal cord injury. Just give me a second. Okay, now I just want you guys to just write down in the comment section, in the chat section, like are you guys clear with the Cauda equina syndrome? Is it getting clearer or not? क्या ये हमें समझ आ रहा है Cauda equina syndrome or no? Yes or no? I just want you guys to just write this in the comment section. Okay. Okay, I'm happy to know that you guys are liking it, and I hope it is interesting. Okay, great. That's great. And आई होप दिस इज़ इंटरेस्टिंग। मैं ट्राई कर रहा हूँ कि जितना कम से कम इसको मैं बोरिंग रख पाऊँ उतना बेटर है। ओके ठीक है, ओके, आई होप इट इज़ इंटरेस्टिंग, ठीक है। ओके, लेट्स जस्ट टॉक अबाउट द लास्ट फ्यू ऑफ द लास्ट थिंग्स जो कि हमें बात करनी है, ठीक है। कॉजेज पहले हम देख लेते हैं, देन लेट्स जंप ओवर टू द फिजिकल एग्जामिनेशन, एंड इसके बाद में विल बी टॉकिंग अबाउट द सर्जिकल ट्रीटमेंट। तो सर्जिकल ट्रीटमेंट में देयर सम सर्जिकल मेथड्स दैट वी कैन गो फॉर, लेट नॉट वी कैन गो फॉर, बट द सर्जन कैन गो फॉर। ओके, तो फर्स्ट ऑफ ऑल, talking about the causes of the Cauda equina syndrome. Majorly, we have seen that it can be because of disc herniation. Like we saw this, that it was almost 72 point something percent na, for the because of disc herniation. इसके अलावा it can be because of this trauma where there is fracture of the vertebral structure, and which is even eventually leading to the compression of the Cauda equina. There can be this neoplasm, or we can say the metastatic cord compression, है ना, because of metastasis which can lead to the compression of the Cauda equina. देयर कैन बी, जैसे आपने ये बताया था, पॉट्स डिजीज। तो पॉट्स डिजीज बेसिकली मीन्स दिस ट्यूबरक्लोसिस ना, देयर कैन बी दिस ट्यूबरक्लोसिस दैट कैन अफेक्ट द पर्सन। तो कैन एनीवन टेल मी दिस कि ट्यूबरक्लोसिस की अगर हम बात करते हैं, विच इज़ द फर्स्ट स्ट्रक्चर विच गेट्स अफेक्टेड बिकॉज ऑफ ट्यूबरक्लोसिस पूरे बॉडी में, एक्सेप्ट लाइक नॉट ओनली द मस्कुलर स्केलेटल स्ट्रक्चर्स, लेकिन इसके अलावा अगर हम विसरा की भी बात करते हैं, या एग्जैक्टली लंग्स, है ना, exactly, it is the exactly it is the respiratory system. The respiratory structures are the first which get affected because of the tuberculosis, and the next to that it comes the vertebral structure. So then we can say the vertebral structure, it gets affected because of the tuberculosis, and that is basically called as Pott's spine, and that is called as Pott's spine. And because of tuberculosis, if there is any affection of the spinal cord, अगर spinal cord affect हो रहा है, that will of course lead to, majorly it will lead to paraplegia, and that is called as Pott's paraplegia. तो Pott's term हम सिर्फ तब use करेंगे when there is any condition or any kind of affection of the vertebral structures because of tuberculosis. There is one more thing that is called as Pott's fracture. किसी ने अगर कोई बताना चाहे, Pott's fracture, this is the eponym basically given to a particular type of fracture. सादिया, यू आर सेइंग नी कंडीशंस, मैं समझा नहीं नी कंडीशंस किसको लेके। आई एम आस्किंग अबाउट पॉट्स फ्रैक्चर। एक तो मैंने बोला कि देर इज दिस कंडीशन दैट इज कॉल्ड एज पॉट्स पैराप्लेजिया, या एग्जैक्टली दैट इज एंकल फ्रैक्चर, सॉरी, तो है ना। तो एक तो कंडीशन है दैट इज पॉट्स डिजीज, दैट इज, और पॉट्स डिजीज दैट इज बेसिकली द ट्यूबरक्लोसिस, एग्जैक्टली दैट इज बाय मैल्यूलर फ्रैक्चर। तो एक तो पॉट्स डिजीज है जिसकी हम यहाँ पे बात कर रहे हैं। तो पॉट्स डिजीज मीन्स द अफेक्शन ऑफ द वर्टिबल कॉलम बिकॉज ऑफ ट्यूबरक्लोसिस, that is called as Pott's disease, या affection of the spinal cord because of tuberculosis that leads to Pott's paraplegia. दूसरा एक और कंडीशन होता है दैट इज अगेन द पॉट्स, बट दैट इज कॉल्ड एज पॉट्स फ्रैक्चर। दैट इज बेसिकली द बायमैल्यूलर टाइप ऑफ फ्रैक्चर जो आपने अभी बताया। इट मीन्स दोनों हमारा लैटरल एंड मीडियल मैल्यूलस, दोनों का दोनों मैल्यूलस, लैटरल मैल्यूलस इज फाउंड बाय डिस्टल फ्यूबुला, है ना, एंड द मीडियल मैल्यूलस इट इज फाउंड बाय द डिस्टल टिबिया. So it means that the distal fibula and the distal tibia, if there is any affection, any fracture of both of these structures, that is called as Pott's fracture. Along with that, there is another fracture that is called as Cotton's fracture. इसको जो that is the trimallular fracture, जहाँ पे दोनों malleoli, इसके साथ में the posterior part of the tibia also gets fractured. That is called as trimallular fracture. लेकिन bimallular fracture is also called as Pott's fracture. तो उसका टीबी से कोई लिंक नहीं है, दैट इज ऑल टुगेदर डिफरेंट थिंग, लेकिन वहाँ पे दैट इज बीइंग कॉल्ड एज स्पॉट्स फ्रैक्चर, बायमैल्यूलर फ्रैक्चर, एंड दिस इज कॉल्ड एज स्पॉट्स डिजीज, दैट इज tuberculosis of the vertebral structure, ठीक है। और because of TB there might be affection of the Cauda equina as well, and that can lead to Cauda equina syndrome, ठीक है। इसके अलावा there can be ankylosing spondylitis as well, of course, and we know that the prevalence of ankylosing spondylitis is much higher in males as compared to females. The ratio is almost 10:1. In every 10 males there is one female having ankylosing spondylitis. It is also called as bamboo spine ना, तो we can say because of ankylosing spondylitis again there might be affection of the cauda equina. And the last thing, that is the iatrogenic. तो iatrogenic, can anyone tell me the exact meaning of the term iatrogenic? किसी को कोई idea हो? The term iatrogenic. Just give me a second, मैं तब तक थोड़ा सा पानी पी लूँ. नो इट्स नॉट अननोन. अननोन तो वो होता है ना. व्हाट इज द टर्म फॉर अननोन? इडियोपैथिक, एग्जैक्टली, सॉरी. दैट इज इडियोपैथिक. तो हाँ, एग्जैक्टली, दैट इज बिकॉज ऑफ मेडिकल कंडीशन. तो if there is any, like अगर हम cause की बात करते हैं of any condition, and if we don't exactly know the cause, then we say that that condition is idiopathic in nature. लेकिन अगर हम iatrogenic term अगर हम use करना चाह रहे हैं, it means that if there is any condition that is because of medical negligence या because of any kind of medical procedure की वजह से वो condition उस person में arise हो जाती है, then we use the term iatrogenic. तो फॉर श्योर आई जस्ट वॉन्ट यू गाइज कि आज के बाद में जब भी आप ये टर्म अगर कभी यूज़ करो, मतलब कहीं ना कहीं मौका ढूंढना, मैं तो मौका ढूंढता रहता हूँ ये ऐसे टर्म यूज़ करने का. जस्ट ट्राई टू फिगर आउट कि कहीं पे आपको मौका मिलता है, जस्ट यूज दिस टर्म, दैट इज आई, दिस इज आई, ठीक है. आइट्रोजेनिक इट मीन्स any condition in the person that arises because of any kind of medical procedure, that is called as iatrogenic nature of that condition or the iatrogenic cause of that condition. So here we can see कि there might be any kind of hematoma which is formed because of any kind of spinal anesthesia procedure, है ना. तो और any kind of, let's say हम lumbar puncture करना चाह रहे हैं, या किसी भी medical procedure में if there is any other condition जो कि वहाँ पे arise हो जाते हैं, let's say यहाँ पे hematoma arise हो गया, and because of that now we can see there is this cauda equina syndrome जो उस person में arise हो रहा है. So then we can say that condition, that hematoma is iatrogenic in nature. It is because of any kind of medical procedure or any kind of medical negligence. Okay. Now coming up to the physical examination. Okay, so till now we have seen the structure of the cauda equina. We have talked about the nerves which are part of the cauda equina. We have talked about the segments जहाँ से जहाँ तक cauda equina present होता है, and we have seen कि उसका clinical relevance क्या है. We have talked about the red flags. We have talked about the symptoms that we can see and the clinical features जो कि हमें cauda equina में देखने को मिल सकता है. Now let's see कि let's say हमारे पास एक patient आता है with low back pain or maybe with any condition related to that particular region, and again the person is showing all these symptoms. The person might be showing any kind of affected bowel bladder function, या इसके अलावा the person might be showing any kind of pins and needles in the leg. जो भी हमने symptoms की अभी तक बात कर ली है, अगर वो सब patient अगर show कर रहा है, तो in that case it's your responsibility to go for physical examination. Of course इसका ट्रीटमेंट, कॉडा इक्विना सिंड्रोम का ट्रीटमेंट इज नॉट अंडर द स्कोप, अंडर द डोमेन ऑफ फिजियोथेरेपी, लेकिन द फिजिकल एग्जामिनेशन इज अंडर आवर स्कोप, ठीक है. तो इसका फिजिकल एग्जामिनेशन फॉर श्योर हमें करना ज़रूरी है, एंड फिजिकल एग्जामिनेशन करने के बाद ही, इसको प्रॉपर डॉक्यूमेंट करने के बाद ही वी नीड टू रेफर द पेशेंट टू द जनरल प्रैक्टिशनर और टू द स्पेशलाइज्ड पर्सन हु इज़ रिस्पॉन्सिबल फॉर दैट कंडीशन, ठीक है. तो उस पर्सन को हम रेफर कर सकते हैं, लेकिन ओनली आफ्टर दिस प्रॉपर डॉक्यूमेंटेशन ऑफ द फिजिकल एग्जामिनेशन. नाउ लेट्स सी कि क्या क्या चीज़ें हम कर सकते हैं फॉर द प्रॉपर एग्जामिनेशन, फॉर द फिजिकल एग्जामिनेशन. फर्स्ट ऑफ ऑल वी कैन सी हियर कि वी कैन गो फॉर दिस वी कैन गो फॉर दिस डर्माटोमल एंड मायोटोमल टेस्टिंग, है ना. तो आई थिंक वी आर ऑल क्लियर विद द टर्म्स डर्माटोम्स एंड मायोटोम्स. वी ऑल हैव हर्ड दीज टर्म्स ना. इट मीन्स दैट लेट्स से अगर हम डर्माटोम की बात करते हैं तो वी कैन से कि जस्ट गिव मी अ सेकेंड. ओके, तो यहाँ पे हम कह सकते हैं कि लेट्स से अगर हम एक पर्टिकुलर रीजन की बात करते हैं स्किन की, तो इस स्किन पे सेंसेशन अगर हम कहते हैं तो विच सेगमेंट ऑफ द स्पाइनल कॉर्ड या कॉर्डा इक्वाना या स्पाइनल कॉर्ड का कौन सा सेगमेंट है जहाँ से नर्व रूट्स आ रहे हैं, विच इज इवेंचुअली रिस्पॉन्सिबल फॉर द सेंसेशन ऑफ दिस रीजन, दोज आर कॉल्ड एज डर्माटोम्स. एंड इसके अलावा द मायोटोम्स मीन्स कौन सा सेगमेंट ऑफ स्पाइनल कॉर्ड या कॉर्डा इक्वाना विच इज रिस्पॉन्सिबल फॉर द motor contraction or motor control of that particular region, that is called as myotome, है ना. तो dermatomes and myotome, so we need to go for proper dermatomal and myotomal testing or in that person, na, so as to figure out if there is any kind of weakness of the muscles or any kind of decreased sensation, affected sensation. इसके अलावा ऑफ कोर्स इफ वी नो दिस दैट द कॉर्डा इक्वाना सिंड्रोम इज अ लोअर मोटर न्यूरॉन लीजन टाइप कंडीशन, तो इन दैट केस वी नीड टू रूल आउट कि क्या उस कंडीशन उस पर्सन में एक्चुअली में कॉर्डा इक्वाना सिंड्रोम है, या क्या हम स्पाइनल कॉर्ड इंजरी को कॉर्डा इक्वाना तो नहीं समझ रहे हैं। तो वी नीड टू डिफरेंशिएट इट प्रॉपरली कि क्या वहाँ पे कॉर्डा इक्वाना सिंड्रोम प्रेजेंट है या क्या वहाँ पे स्पाइनल कॉर्ड इंजरी प्रेजेंट है। तो इन दैट केस वी कैन टेस्ट दिस साइंस फॉर अपर मोटर न्यूरॉन, दैट इज द क्लोनस जिसकी हमने अभी बात कर ली, और द बेबिन्स्की साइन। कैन एनीवन टेल मी बेबिन्स्की साइन में, बेबिन्स्की साइन जब हम टेस्ट करते हैं तो इन दैट केस वी स्ट्रोक अलोंग द प्लांटर साइड ऑफ द फुट, है ना, अलोंग द लैटरल पार्ट ऑफ द प्लांटर साइड ऑफ द फुट। तो इन दैट केस so as to show positive Babinski sign, is there curling of the fingers or is there extension and fanning of the okay exactly एकदम से आंसर आ गया, there is fanning, है ना, exactly। तो it means it means कि अपने प्लांटर साइड पे, फुट के प्लांटर साइड पे आपने आपने स्ट्रोक किया, एंड इन दैट केस द पर्सन शोड फैनिंग। फैनिंग मीन्स एबडक्शन एंड एक्सटेंशन, एग्जैक्टली एक्सटेंशन ऑफ द ग्रेट टो, है ना, ग्रेट टो ऑफ द एक्सटेंशन ऑफ द ग्रेट टो एंड फैनिंग, अगर वो पर्सन शो कर रहा है तो इन दैट केस वी कैन से फॉर श्योर द पर्सन द कंडीशन इज अपर मोटर न्यूरल लीजन टाइप। एंड वहाँ पे हम बोल सकते हैं कि ऑफकोर्स वो कंडीशन जो है दैट इज दैट उस पर्सन में स्पाइनल कॉर्ड माइट बी अफेक्टेड एंड नॉट द कॉर्डा इक्वाना, ठीक है। दैट इज द बेबिन्स्की साइन। लेकिन लेट्स से अगर हमारे पास एक इन्फेंट है ऑफ लेट्स से 1 ईयर ऑफ एज, अगर 1 ईयर या 1.5 ईयर का अगर पर्सन एक इन्फेंट है हमारे पास में, एंड उस इन्फेंट में अगर हम टेस्ट करते हैं दिस बेबिन्स्की साइन, तो क्या उसमें अगर हमें फैनिंग देखने को मिलता है अगर, तो इज दैट अ नॉर्मल थिंग और नॉट? क्या हम ये भी बोल सकते हैं कि एग्जैक्टली दैट इज द नॉर्मल ना? तो इट मीन्स दैट इज द नॉर्मल थिंग। तो इट मीन्स कि व्हेन इफ वी टॉक अबाउट दिस बेबिन्स्की साइन, या फिर अगर हम इन रिफ्लेक्सेस की बात करते हैं, तो वी कैन से इट डेवलप्स ओनली आफ्टर एग्जैक्टली दिस प्रिमिटिव रिफ्लेक्सेस। तो वी कैन से इट अराइजेज ओनली आफ्टर 2 or 2.5 years of age, बट बिफोर दैट इफ वी टेस्ट द बेबिन्स्की साइन इन एन इन्फेंट, तो वो जो चाइल्ड है, चाइल्ड विल शो एक्सटेंशन एंड फैनिंग ऑफ द टोज, बट दैट डजेंट नेसेसरली मीन कि उस इन्फेंट में, उस चाइल्ड में अपर मोटर न्यूरल लीजन प्रेजेंट है, ठीक है। इट डजेंट मीन कि उसमें प्रेजेंट है, ठीक है। तो बट इन एन एडल्ट अगर हम सेम चीज़ अगर टेस्ट करें, एंड इफ द एडल्ट इज ऑल्सो शोइंग दिस एक्सटेंशन एंड फैनिंग ऑफ द ग्रेट टो और ऑफ द टोज ऑफ द फुट, so in that case then it is a problem, then we can say that there is a prevalence of upper motor neuron lesion. So it means we need to rule out ki whether there is upper motor neuron lesion or whether there is a lower motor neuron lesion, and uske according we can differentiate ki whether there is this spinal cord injury or condition related to the cauda equina, ठीक है। then we can figure out, so we need to go for the screening. इसके अलावा वी कैन सी दैट वी नीड टू गो फॉर द टेस्टिंग ऑफ द सेंसरी चेंजेस इन द पेरिनियम रीजन ना। तो पेरिनियम, ऑल दिस रीजन, द सैडल रीजन, द पेरिनियम अलॉन्ग विद दैट द मीडियल साइड ऑफ द थाई, तो वहाँ पे सेंसेशंस जो है आर दे अफेक्टेड और नॉट। इसके अलावा वी नीड टू गो फॉर दिस डिजिटल रेक्टल एग्जामिनेशन। तो ऑफकोर्स देर इज दिस decreased amount of muscle tone na, decreased tone in the individuals with lower motor neuron lesion or with cauda equina syndrome. So of course we can see there that we need to place our finger in the rectal region, and then we need to figure out whether there is a decreased amount of muscle tone or not. That is called as digital rectal examination. And then we can in the end we can test the bulbocavernous reflex and the cremasteric reflex as well. So bulbocavernous reflex, basically it means that majorly in males we can go for the bulbocavernous reflex, where we can see जो अगर हम penis की बात करते हैं, तो the person, the examiner needs to stimulate the penis, and at the same time the person needs to place their finger inside the anal region, and sorry, and the person needs to check this ki whether there is any kind of contraction or any kind of increased muscle tone in the anal region with the क्या कहते हैं उसको, अगर अगर वो penis को अगर वहाँ पे एक्टिवेट कर रहे हैं, तो if there is any kind of sensory input given to the penis, is there any kind of muscle tone increasing in the anal region or not? So that is called as bulbocavernous reflex. If there is absence of this bulbocavernous reflex, so then we can say ki that shows ki there might be presence of this lower motor neuron or any kind of affection of the structure. And इसके अलावा this cremasteric reflex as well. So cremasteric reflex means we need to the medial side of thigh है, if the examiner strokes along the medial side of the thigh, and if there is retraction of the testicle on the same side, उसी side पे अगर टेस्टिकल का रिट्रैक्शन if it moves as a reflex, if it moves upwards with the stroking of the medial side of the thigh, that is called as cremasteric reflex. So if that is absent, so that might again show the presence of any kind of affection of the nerve of the neural structures related to that structure. ठीक है, so we can go for all these testing the physical for the physical examination. Okay, now talking about some of the scoring systems that we can use in case of Cauda equina syndrome. You can see कि in how much depth we need to go for अगर एक person में we are seeing all these symptoms of Cauda equina syndrome, we definitely need to go for all these testing, and along with that we need to go for these testing scales or these testing systems and all that. So first of all, I think we all have heard about the ASIA scale, that is the American Spinal Injury Association. So that is called as ASIA scale, and ASIA scale is majorly used for spinal cord injuries. Na? So in case of spinal cord injuries, we can go for the ASIA scale, and that is used to figure out the level of spinal cord. किस कौन से स्पाइनल कॉर्ड के लेवल पे या कॉर्डा इक्वाना के कौन से लेवल पे हमें वो कंडीशन या इंजरी देखने को मिल रही है. And along with that, it can also be used to figure out कि क्या spinal cord injury is it complete or is it incomplete. तो complete means कि it means that all the nerves, all the tracts which are passing through the spinal cord. Let's say अगर मैं इस तरह से बोलता हूँ, let's say this is the spinal cord, and अगर मैं बोलता हूँ कि spinal cord से सारे के सारे there is complete like lysis, complete transection of the spinal cord, जहाँ पे सारे इसके जो ट्रैक्ट्स है सारे के सारे, तो ऑल दोज आर बीन अफेक्टेड. तो इन दैट केस वी कैन से दैट इज कंप्लीट स्पाइनल कॉर्ड इंजरी. और इन अदर केसेस वी कैन से कि वहाँ पे सारे के सारे ट्रैक्ट्स अफेक्ट नहीं हुए हैं, बट सम ऑफ देम गॉट अफेक्टेड एंड द रेस्ट ऑफ देम आर स्टिल इंटैक्ट. तो इन दैट केस वी कैन से दैट इज इनकम्प्लीट टाइप ऑफ स्पाइनल कॉर्ड इंजरी. So for that also we can use the ASIA scale, and we can figure out whether the spinal cord injury or the Cauda equina syndrome is that injury complete or incomplete. ठीक है, incomplete है, complete है, इसके अलावा the level of spinal cord injury. तो for that we can go for this sensory testing. हम वहाँ पे dermatomes and myotomes we can test, and इसके अलावा we can go for we can check all these structures, and eventually we can figure out the level or the grade of spinal cord injury or the Cauda equina syndrome injury की कि वहाँ पे कौन सा ग्रेड ऑफ एशिया स्केल में प्रेजेंट है. तो ग्रेड ए मीन्स इट इज़ द मोस्ट वर्स्ट कंडीशन. तो ग्रेड ए मीन्स कंप्लीट इंजरी, एंड ग्रेड ई मीन्स लाइक जो सबसे बेस्ट है. इट मीन्स कि देर इज नो इंजरी, और वी कैन से द मोटर एंड द सेंसरी फंक्शंस आर इंटैक्ट. तो लाइकवाइज वी कैन टॉक अबाउट दिस. एंड अगर कंप्लीट स्पाइनल कॉर्ड इंजरी है और कंप्लीट कॉर्डा इक्विना इंजरी है, तो इन दैट केस वी कैन से दैट फॉल्स अंडर द कंप्लीट द ग्रेड ए. इसके अलावा अगर इनकम्प्लीट है देन इट फॉल्स अंडर ग्रेड बी, सी, डी एंड ई, डिपेंडिंग अपॉन द अमाउंट ऑफ मोटर फंक्शंस एंड द सेंसरी फंक्शंस विच आर प्रेजेंट देयर. दैट इज द एशिया स्केल दैट वी कैन यूज. Along with that, there is this another scale, that is this one, that is called as the SINS scale. This one, that is the SINS scale, that is spinal instability neoplastic scale. तो in the individuals in which we can see कि अगर उस individual में कोई metastatic condition present है, if there is any prevalence of metastasis in that person, so in that case we need to go for the SINS scale, that is spinal instability neoplastic score. तो इसमें बेसिकली क्या हो रहा है, इट इज़ लाइक ओवरऑल टोटल अगर हम इसका स्कोर की बात करते हैं दैट इज़ आउट ऑफ 18, ओवरऑल 18 है. एंड वी टॉक अबाउट डिफरेंट करेक्टरिस्टिक्स विच आर गेटिंग अफेक्टेड बिकॉज ऑफ दैट मेटास्टेसिस. उस मेटास्टेसिस की वजह से क्या क्या स्ट्रक्चर्स, क्या क्या फंक्शंस या क्या क्या करेक्टरिस्टिक्स अफेक्ट हो रहे हैं. वी कैन टॉक अबाउट दोज थिंग्स. एंड यहाँ पे जितना ज़्यादा वर्स कंडीशन है उतना ज़्यादा स्कोर हम देते हैं उस कंडीशन को. तो हेयर वी कैन सी अगर हम लोकेशन की बात करें तो टॉकिंग अबाउट द लोकेशन ऑफ मेटास्टेसिस वी कैन सी दैट एट द जंक्शन, अगर जंक्शनल रीजन पे अगर मेटास्टेसिस प्रेजेंट है, लेट्स से अगर हमारा C7 सर्वाइकल थोरैसिक जंक्शन और यू कैन से थोरैसिक लंबर जंक्शन पे अगर प्रेजेंट है और लंबर सैक्रल जंक्शन पे अगर प्रेजेंट है, तो इन दैट केस वी कैन गिव इट अ हाई स्कोर. इट मीन्स इट इज़ मच वर्स of the metastasis as compared to this one जहाँ पे the condition is the metastasis is present on a rigid structure. let's say अगर हमारा sacrum है तो sacrum पे there is no mobility, sacrum की अपनी कोई mobility present नहीं है ना between the C1, C2 sorry S1, S2 and all that. तो वहाँ पे we can say कि it is the best one. लेकिन अगर हम जहाँ पे मोबिलिटी की ज़रूरत है, वहाँ पे अगर हमें मेटास्टेसिस देखने को मिल रहा है तो इट इज़ द मोस्ट वर्स्ट वन. तो इन दैट केस वी कैन गिव इट अ स्कोर 3. Likewise in pain, if the pain is present, then we can give it a score 3, and if the pain is absent, then 0. Likewise we can talk about this as well. Bone lesion. देखो bone lesion दो टाइप के होते हैं, the lytic bone lesion एंड द ब्लास्टिक बोन लीजन. तो ब्लास्टिक बोन लीजन इज स्टिल बेटर. मतलब कि लेट्स से हम कह रहे हैं कि उस पर्सन में कोई ना कोई बोन लीजन हुआ, बोन इफेक्ट हुआ, एंड बिकॉज ऑफ दैट नाउ वी कैन सी इन द रिस्पॉन्स, मतलब कि बोन इफेक्ट होने के बाद में देर इज दिस कैलस फॉर्मेशन एंड बोन सेल्स डिफॉर्मेशन हो रहा है वहाँ पे, और वी कैन सी ऑस्टियोब्लास्ट वहाँ पे प्रेजेंट है, जो कि इवेंचुअली अगेन विच आर कन्वर्टिंग इनटू ऑस्टियोसाइट्स ना, मैच्योर बोन सेल्स. तो देर इज दिस ऑस्टियोब्लास्टिक एक्टिविटी वहाँ पे हो रही है, और वी कैन कॉल इट एज this kind of this blastic type of bone lesion. The another one, that is the lytic type of bone lesion, where we can see the bone is like bone एकदम फट रहा है, bone is getting burst out. तो in that case we can talk about this condition यहाँ पे. तो this type of presentation, this is called as lytic lesion. ठीक है, तो दिस इज द लाइटिक लीजन. एंड ब्लास्टिक लीजन की अगर हम बात करते हैं, दैट इज नॉर्मली द लीजन ऑफ एनी बोन, जहाँ पे उस बोन में अगेन देर इज रीफॉर्मेशन ऑफ द न्यू बोन सेल्स, दैट इज कॉल्ड एज ब्लास्टिक टाइप ऑफ लीजन. तो देर आर टू डिफरेंट टाइप्स ऑफ लीजन दैट वी कैन टॉक अबाउट, एंड ऑफ कोर्स द लाइटिक लीजन इज मच वर्स देन द ब्लास्टिक लीजन. ठीक है, कैन विदाउट रीडिंग द नेम, आपने नाम पढ़ लिया होगा, बट कैन एनीवन टेल मी कि ये कौन सा कंडीशन हमें यहाँ पे दिख रहा होगा? दिस इज बेसिकली स्पाइना वेंटोसा. एंड अभी हम बात कर रहे थे ना अबाउट टीबी. तो दिस कंडीशन कैन बी सीन बिकॉज ऑफ टीबी ओनली, बिकॉज ऑफ ट्यूबरक्लोसिस. जैसे आप सबने बताया अभी कि इन द बिगनिंग द टीबी कैन द टीबी कैन अफेक्ट द रेस्पिरेटरी सिस्टम, लेकिन उसके बाद में इट देन स्टार्ट्स अफेक्टिंग द वर्टिब्रल स्ट्रक्चर्स. उसके बाद में दैट इज फॉलोड बाय द हिप जॉइंट और मे बी बाय द नी जॉइंट. उसके बाद में द टीबी माइट अफेक्ट द इंटरफेरेंजियल जॉइंट एज वेल. तो अगर इंटरफेरेंजियल जॉइंट अगर अफेक्ट हो रहा है तो इन दैट केस वी कैन सी दिस टाइप ऑफ लाइटिक लीजन, दैट इज कॉल्ड एज, this condition is called as spina ventosa. And spina ventosa is basically the condition that arises because of the tuberculosis of the IP joint. ठीक है, that is called as spina ventosa. And this type of lesion is called as lytic lesion. And of course lytic lesion is much worse. Likewise we can talk about this radiographic spinal alignment. So like if it is like if there is any kind of subluxation or any kind of translation, that then we give it a high grade. If there is any the de novo type of deformity, it means there is नो सबलक्सेशन, लेकिन हमें वहाँ पे एज अ होल पूरे वर्टिबल कॉलम में किसी टाइप का डिफॉर्मिटी देखने को मिल रहा है. इट मीन्स कि इंक्रीज और डिक्रीज काइफोसिस और एनी काइंड ऑफ स्कॉलियोसिस, देन दैट इज कॉल्ड एज डी नोवो टाइप ऑफ डिफॉर्मिटी. और इफ देर इज एनी काइंड ऑफ वर्टिबल स्ट्रक्चर गेटिंग कोलैप्स्ड और एनी काइंड ऑफ इन्वॉल्वमेंट ऑफ द स्पाइनल एलिमेंट्स है ना, बायलैटरल अगर है तो इन दैट केस वी गिव इट अ हाई ग्रेड. तो इवेंचुअली वी एड अप दीज ग्रेड्स एंड देन वी सी कि अगर ग्रेड हाई है, अगर स्कोर हाई है, so in that case if it is between 13 and 18, then we call it as the condition is highly unstable. 7 to 12 to mid में, and if it is 1 to 6 then it is much stable. So likewise we can use the SINS score again in case of metastatic condition which is leading to Cauda equina syndrome. Okay, so in the end coming up to the treatment part of it, so now we can see since we have figured out कि ठीक है कॉडा इक्वाना सिंड्रोम उस पर्सन में प्रेजेंस होने के चांसेस है, जो हमने वहाँ पे फिजिकल एग्जामिनेशन किया, जो हमने वहाँ पे जो स्कोर टेस्टिंग सिस्टम हमने जो यूज़ किया, या फिर जो हमने अपनी तरफ से जो बल्बो कैवर्नस रिफ्लेक्स, या फिर हमने क्लोनस टेस्टिंग किया, हमने रिफ्लेक्स टेस्टिंग किया, मसल टोन हमने टेस्ट किया, एंड वो सब चेक करने के बाद में अगर हमें लग रहा है कि इफ़ देयर इज़ अ हाई प्रेवलेंस ऑफ कॉडा इक्वाना सिंड्रोम इन दिस पर्सन, of course we need to refer that person to another individual, and then we can see कि उस person में अगर हम treatment की बात करें, the best thing is to go for surgical decompression within first 24 to 48 hours, because जितना time person waste करेगा उतना ही there is a high chance कि cauda equina जो है वो affect होता जाएगा, and जो condition जो affect हो गए उनका वापस आने के chances उतना ही कम हो जाएंगे. तो वी कैन से जितना जल्दी हो सकता है उस पर्सन को फर्स्ट 24 to 48 आवर्स में उस द पर्सन नीड्स टू बी रस्ट फॉर दिस एमरजेंसी सर्जिकल प्रोसीजर. एंड इन दैट केस द मेजर सर्जरी दैट इज डन, दैट इज दिस सर्जिकल डीकम्प्रेशन, जहाँ पे उस कॉडा इक्वाना सेगमेंट के ऊपर जहाँ पे कंप्रेशन आ रहा है, that structure is decompressed, उसके ऊपर compression को decrease किया जाता है by surgical procedure of course. Apart from that, they can go for the drainage of the, in case of abscess, अगर कोई abscess present है, because of that abscess, if there is compression of the spinal cord, then they can go for the drainage as well. There is this type of surgery that is called as laminectomy. So basically there are three different types of laminectomy. एक हमारा है that is the laminotomy. Laminotomy means there is removal of a part of the lamina, unilateral side पे एक side, because lamina of course it is present bilaterally ना, and lamina is part of the vertebral structure. So we can say lamina unilaterally एक particular part of the lamina, if it is removed, that is called as laminotomy. If the complete lamina is removed unilaterally, that is called as hemilaminectomy. And if the lamina is removed completely on both the sides, that is called as complete or just laminectomy. So we can call it as complete laminectomy or just laminectomy. So there is laminotomy, hemilaminectomy, and then complete laminectomy. Apart from that, in case of fracture conditions, the person can go for fracture fixation or the removal of foreign body if that is leading to any kind of compression on the structures. So these are the procedures that we can go for in case of patients with Cauda equina syndrome. So I hope we are all clear with the Cauda equina, and that is the end of the PPT. And in the end, I would like to talk about this last thing as well. That is like I would like to just share about this 2 month MPT entrance course, and I think a lot of you guys have attended this course, है ना? And I hope you guys would have liked it. And I would like to announce this another webinar as well, that is on 25th of September. ठीक है, that will be on 25th of September, and the topic for that will be the flag system, जो मैंने बीच में एक जगह पे term use किया था, the white flag and the red flags, and इसके अलावा there are other flags as well. तो like what is the use of this flag system screening, and उसके अलावा ये flag systems होता क्या है, इसका use क्या होता है, and how to use them. तो उसके ऊपर will be having this seminar on 25th of September. ठीक है, and that will be again in the same way on Google Meet. ठीक है, so that is the end of this PPT, and I hope you guys would have liked it, and I just want a feedback from you guys. Okay Sonam, thanks. And is there any doubt? अगर आपको कोई doubt है, just let me know. If you guys have any doubt, just you can send it here, or you can send it in the group as well. तो उस group को मैं हटाऊंगा नहीं, we'll just keep that group. एंड उस ग्रुप में अगर आपको कोई डाउट रहता है या इसके अलावा कोई और कंडीशन का भी अगर को लेकर अगर डाउट रहता है, जस्ट लेट मी नो. वी विल बी डिस्कसिंग ऑन दोज टॉपिक्स मे बी इन द नेक्स्ट वेबिनार, या जिसमें भी अगर आप उसमें अटेंड उसको करना चाहते हो तो. ठीक है, सो आई होप यू गाइज वुड हैव लाइक्ड इट, एंड सो थैंक्स अ लॉट, एंड आई होप यू गाइज वुड हैव रिसीव दिस हैंड बुक. अगर किसी को नहीं मिला है, जस्ट टेक्स्ट मी पर्सनली एंड मैं आपको हैंड बुक सेंड कर दूंगा. Okay, so thank you so much. Okay, that was great. It was really interesting, and of course I came across new terms. Okay, that was great, and I hope you guys will start at least ruling out the Cauda equina syndrome in cases with low back pain or with any condition related to that region, no? Okay, okay, thanks a lot. So let's wind up, and let's wind the webinar here only. So thank you everyone.